So people, in this video, let us look at this topic, chikungunya. Chikungunya is a viral disease. It is transmitted by the virus. Which virus? It is caused. It is caused by the virus. Which virus? CHIKV virus. Such a cute name. See, it has CHIKV. That is chikungunya virus. So basically, who is carrying this virus to you? Mosquito. So mosquito is what? The vector. What is inside the mosquito? Virus. Okay. Who gave the virus to the mosquito? Interestingly, it is man. So man to mosquito, mosquito to man it is. Okay. So it's a mosquito-borne viral disease caused by the virus, chikungunya virus, that is CHIKV virus. So man to mosquito, mosquito to man in the urban cycle. This is how it is. Which mosquito? Aedes mosquito. Mainly the Aedes aegypti or the Aedes albopictus mosquito, which bites during the day mostly. Okay, it is this tiger type of mosquito. It has this black and white bands, right? So basically, understand this, that this is the cycle in where we live. If you're living in the forest and etc., then primates also will be the reservoir. Okay, other primates. So basically, this is a chikungunya is caused by this alpha virus. They say. What do you mean by alpha virus? Under viruses, you have DNA virus and RNA virus. So basically, we are talking about RNA viruses here. In that, we have arbovirus. Under arbovirus, you have alpha virus, which is the chikungunya virus. So remember here, alpha virus is the family. Okay, correct, right? What I'm saying. So it's a group of virus. Alpha virus, chikungunya virus, fever, arthritis spread by mosquito. Okay. RNA virus it is. So now you have understood what alpha virus is. So basically this chikungunya virus causes fever, rash and arthropathy, mainly joint pain. Remember, okay? So you have understood everything on the slide. Humans and non-human primates. Primates basically are the main reservoir. Vector is Aedes mosquito, that is Aedes aegypti, Aedes albopictus. Okay, this will lay eggs in standing water. Everything lays eggs in standing water only. Who will lay eggs in moving water? I didn't understand till now. Which mosquito? So basically it bites during the day. That much you have understood, right? So why did this name come, chikungunya? Chikungunya name is from Tanzania itself, from where this virus was first identified. So basically they mean to say the man is looking like the chicken. Stooped appearance, okay, of sufferers with joint pain. Stooped appearance of sufferers with joint pain. That is why they have given the name chikungunya, nothing to do with chicken, okay? Then transmission, we told you, right? Because of this mosquito biting you during daylight, usually they bite and they will lay eggs in standing water. That also we have told you, right? So during day itself, it will bite you and infect you. So how did the mosquito get the virus? Because of man. It bit a man who was infected. Then the virus will enter this mosquito. There it will replicate inside the mosquito, gets into the salivary glands. Next, whenever it bites a new human, it will give the virus to him. So man to virus, virus to man. Okay. Then, is mosquito the only way of getting this disease? So we're talking about transmission here. So mosquito, you have understood, vector borne. There is also blood borne. Directly, if you take the blood of this infected person, then you will get this virus for free. You have understood, right? So blood borne. Then in utero transmission means what? From inside the uterus, from mother to fetus, right? This also is reported. When is the human most likely to transmit the virus? First week of illness. Okay. First week of illness, he will transmit. Okay. Now we are moving on to location. What is this? Location. What is location? Location of disease. Where was it first identified? Tanzania. Where is Tanzania? South of Africa, somewhere Central Africa. Yes. We'll show you location. So where was it first identified? Tanzania. That's where the name also came from, like looking like chicken, some Tanzanian language. Okay. So basically now this disease is everywhere. 110 countries. So really nothing to know about location except Tanzania word. Everything else you can write. Everywhere it is there now. In India, there was an epidemic in 2006. Okay. Lakhs of cases. Remember that. Location done. Okay. Chikungunya, Tanzania. Very good. Now let's move on to symptoms. Symptoms. Incubation period, you should know 2 to 12 days. How many days? 2 to 12 days. After 12 days, that is almost 2 weeks, you may get symptoms. Okay, what will be the fever? Fever with rash. Remember. So maculopapular rash. They can have rash. So fever with rash means you will think of what and all diseases? Dengue, chikungunya, What else will you think of? So many diseases are there, even HIV. As soon as I said HIV, I think you got angry. But see, fever with rash, viral diseases like rubella, measles, varicella, mumps, herpes, human herpes virus, enteroviruses, right? All these are viral exanthems. Then you have chikungunya, again viral, dengue, this is viral. Typhus, rickettsiosis, okay? Typhoid, parvovirus, HIV. So all these will cause fever with rash. So these and all can be your differential. Remember in chikungunya and dengue, there will be a lot of arthritis, joint pain, right? Then coming here to the symptoms. So we said that rash can be there, but this rash mostly they're saying will be in children, and in adults there will be this joint pain mostly. And which joints? Small joints, remember. And they will have early morning pain and swelling. See, this man got up in the morning and he has what? Early morning pain and swelling in these small joints, okay? And he's sitting like a chicken, okay? That's why they say thing. You chickened out when you quit something, okay? You got scared and you left. Chikungunya has nothing to do with chicken, remember, okay? So this arthritis can go on for some months also in people, etc. They are saying. And that's all for now. Let's move on. So they're saying that most people will feel good within a week, but this joint pain can go on for months, right? And death usually doesn't occur with chikungunya unless there are like other conditions underlying, looks like, okay? And some people are saying that the symptoms will begin after 7 days, 3 to 7 days. So the incubation period, each website is giving different. So there'll be acute polyarthritis, just means suddenly all these joints will start paining. Small joints, they are saying, will start paining. Actually, small joints, remember. And but do you use the name breakbone fever? No, breakbone fever is a term used for dengue. Okay, that you should remember. There can also be viral encephalitis, looks like. So I'll mark this in red. Okay. So did we cover everything in symptoms? Fever, joint pain, because in adult there is not rash that they're saying. They're saying mainly it is joint pain. Okay. And they can have problems of the eye, heart, and neurological complications. So we put encephalitis here, remember. And most of the times you will confuse these symptoms with dengue and Zika. We told you like differentials are very important here. And once you get future infections, you're immune. So that is a green thing. So I put in green. Okay. So how will you detect this and diagnose this condition? So serology, that is antigen antibody testing you will do. Okay. Then you can directly detect the virus in the blood sample in the first week of illness. So you will use RT-PCR, that is reverse transcriptase polymerase chain reaction. So you will read the sequence. You should know the sequence. Then only you will be able to read the sequence of this protein. Polymerase chain reaction usually is for protein only, right? They didn't say it is nucleic acid. So whatever it is, you will find that that exact pattern. You should know the pattern. You should have the have those things which you can identify this pattern, right? Then you can declare it as, what will you declare it as? Chikungunya. Very good. CHIKV virus, they should write in the report, right? Let's see if there is a chikungunya report. Wait, see here. They have detected the virus itself through real-time PCR. They have written it as real-time PCR, not reverse transcriptase. They wrote here as real-time PCR. Then IgM is the immunoglobulin, right? So it is positive. M means what? You have two types, right? IgM and IgG. IgM is in the acute phase itself first. Initially itself you'll be able to detect IgM. Okay, IgG increases later. So here they have detected that this is positive for CHIKV, right? So which are the differentials? Mainly they are confused with dengue and Zika, remember. And a fever with rash means it can be any of these conditions from rubella, measles, varicella, mumps, human herpes, enterovirus, chikungunya, dengue, rickettsiosis, spotted or typhus group rickettsiosis, typhoid. It can be typhoid. It can be parvovirus. It can be HIV. If it's fever with rash that you're trying to differentiate. Okay, if it is thrombocytopenia, that is low platelet count that you're trying to decide. So fever with thrombocytopenia, it could be chikungunya and a lot of other things that you will see. Malaria, sepsis because of any infection, typhoid, again typhoid is coming here, rickettsial infection is again coming here, leptospirosis and other viral hemorrhagic fevers, yellow fever, etc. Okay, so basically remember it is confused with Zika and dengue. That is what you have to know. Zika is caused by what? Again, it is spread by the same Aedes mosquito and it is a member of Flaviviridae, RNA virus only it is again. Okay, but just remember mosquito-borne disease only, Zika. Okay, next. Treatment and vaccines for what? Chikungunya. Let's start with treatment now. So it is not fatal, so I'll mark this as green. Okay, mark it as green. Okay, so it is not fatal. Rarely it is fatal. You just treat symptomatically because why? Why? Because it's a viral disease. There's no specific treatment that you should understand, right? There is no specific antiviral drug treatment as of now for chikungunya because it is a normal viral conditions. Usually they don't give you specific treatment, right? Symptomatic treatment, like you will give antipyretic to reduce fever, analgesics to reduce pain, give plenty of fluids, rest. And then what will you give as a pain relief? You'll give paracetamol or acetaminophen. That it is both are the same thing. Paracetamol or acetaminophen. That is what you give. Why won't you give NSAID like aspirin, etc.? Why? Because they can increase the risk of bleeding, and this can there can be bleeding. Example in dengue, etc. These are hemorrhagic fevers, right? Dengue, etc. So that is why they are saying best viral, give paracetamol. Okay. And if you have this chikungunya in the first week, then you should avoid mosquito bites because you will be transmitting it to other people. Okay. So they're saying you become responsible when you're not well. Okay. At the end of treatment, I will like to say if once you get chikungunya, you're immune the next time. That's what they're saying, right? Okay, now let's move on to prevention. Prevention, we already told you, you should avoid mosquito bites in the first week of your illness so that you will not transmit the disease to others. Okay. Then control of mosquito. How will you do? Breeding. You should control their breeding, stagnant water, etc. You should use mosquito net, and then what else? Insecticides. Everything that PSM part you write, okay? Full about insecticides, etc. All that you do. So wear good covered clothings when you're traveling. You should take extra precaution. You should use repellents. You should use door mosquito screens, window mosquito screens, etc. So basically mosquito control is one way of prevention. The other thing prevention is vaccine. Vaccine currently they are in different stages they are saying. So it looks like they are not approved yet for use. Okay, so I'm putting it in yellow here. They are in different stages they are saying. Currently in different stages of development. Okay. As of 2022 they are saying, but as of 2023 they have some development has happened that you can look at, but anyways as of now it is not available to you at least, right? So in this video you have looked at chikungunya, mosquito-borne viral disease caused by CHIKV, that is chikungunya virus. Okay, that's enough for now. Chikungunya, you have understood everything. You'll pass exam if they ask you, right? Bye bye.